Let's look at the use of kinesiology tape to support thoracic extension in a kyphotic client. Firstly, what is kyphosis? So in this picture we see a client who's both kyphotic and lordotic, and this refers to where we have increased flexion in the thorax, in the thoracic vertebra, so that's kyphosis, and there where we have increased curvature in the lumbar spine or extension in the lumbar spine, and that's called lordosis. So the definition of kyphosis is where we have greater than 45 degrees in flexion in the thoracic spine. Also, this might be seen with a lack of ability to extend. So your clients might be coming to you because they struggle to get into that extension and it affects their mobility. They might also have discomfort or pain in the spine, between the shoulder blades, in the shoulders, in the neck. Who knows? It depends on your client. But on your assessment, it might be clear that this increased flexion through the thoracic spine is part of the problem that you wish to resolve. Perhaps your client has this kyphosis but has no problem, no issue with movement or function, or no pain or discomfort. Therefore, we wouldn't be treating them for that, or we wouldn't be using tape. But if it is reducing their function, their movement, causing pain or discomfort, then we absolutely want to be looking at why this person is struggling to come into extension, and we want to be creating a multifactorial plan to help improve that functionality for the client or to reduce their pain or discomfort. Our treatment goals might be to increase the thoracic mobility, increase that ability to be able to extend the thoracic spine and improve the function. We might also want to improve any symptoms that the client's having, any pain, discomfort or lack of mobility. We also might want to look at what's happening more globally, as when I see a kyphotic client, we often see things happening further down the chain or further up the chain. Do they have head, neck problems? What do their hips look like? What is their gait? What is their feet? What are their activities? Are they doing something repeatedly that's driving this function? And until we address those, we are unlikely to get long-term results. So yes, let's use the taping to help support that client get better mobility through that thoracic spine and to help relieve some of the symptoms, but you must be looking at a wider, broader treatment plan to help your client get lasting results. So we're going to demonstrate a one-step functional fascial taping to support that client in achieving more extension through the thoracic vertebrae. It's not mechanical. We don't want to lock that client into that position. We just want to create a constant stimulus or pull into extension to help support the home care and the work you're doing with that client. So we're going to be using medium levels of tension. Other options are things like inhibiting the pectorals if you believe that's a driving factor, desensitizing any angry or painful tissues that are a result of that extension or lack of extension in the thoracic spine, or for example mechanical shoulder or scapular tapings if again that is indicated by what your client presents with. So as always, assessment and treatment planning is at the heart of getting those long-term results. So let's take a look at how we would do that functional fascial taping to support thoracic extension. We're going to use quite a long anchor, so maybe at least 3 inches of the tape, and we're going to anchor at that thoracic lumbar junction with no tension. And we're going to do this taping on both sides. Okay, so we're going to anchor 2 pieces of tape at that thoral-lumbar junction. Anchor with no tension, tissue is not on stretch. Now I'm going to ask my client to stretch that tissue by bending forward. And now I'm going to add a medium amount of tension to the tape, so stronger than if we were inhibiting, and lay that down right through that thoracic spine, rubbing well to stick. So again, peeling back that active portion of the tape, adding a medium amount of stretch to that tissue and placing it down on that stretched tissue and rubbing well to stick. We really want to rub it well because there's stronger tension. And then we simply anchor the last 3 or 4 inches of tape round the front of the client with no tension and no stretch. So almost like two hands helping to pull the client back into extension.